Thank you very much. Now, I will be giving a brief presentation to avoid taking too much time, and we are just after lunch, so there's a bit of a food coma situation as well. So I'll be speaking about neuromuscular diagnoses, something that previous presenters have already covered. What I need to add in the context of manual techniques is muscle tone, differences in range of motion, and sensory sensitivity, because the pain tolerance of the clients could be on a wide range. It could be way too sensitive or not sensitive enough. So people who are less, who are a lot more tolerant to pain or don't really feel that much pain, that could be a challenge because you might easily strain the joints and the muscles and the tendons and ligaments. You might overstretch people if they don't give you feedback by saying, "Oh, that hurts." Fundamentally, therapeutic development techniques are either passive or active in the context of CMT. In passive, we use craniosacral therapy and manual therapy. And when we talk about active therapies, it's myopathy, muscle tone, joint, range of motion, and other therapies. We have also semi-active and active methods, and systems allowing various degrees of autonomy for the patients. Now, we work on muscles. We work on the fascia, which is basically the fibrous sheath around your muscles. When I talk to parents, I explain this to them, when you have the silver skin on a nice joint of beef that you're cooking, that silver skin is the fascia of the animal. That's the sheath, the fibrous collagen-rich sheath that covers the muscle. And when you stimulate it, it could relax the muscle, and if you have hypotony, if your muscles are not tight enough, they are not too loose, too flaccid, then stimulation might also work in a different way, but in the same context. Now, the manual techniques that are available in Hungary is a long list. These are typically related to the original developer's name, tied to the specific name of a researcher or a therapist. We're talking about soft tissue techniques, stretching, mobilization, acupressure techniques, joint mobilization. And you see and where you see the three exclamation marks, we mentioned chiropraxy, which is a questionable issue, and also you need to be aware of the legislation, because it's not a good idea to either visit somebody, a practitioner that does not have the necessary certification or understanding of the technique, or is not approved. Anyways, input requirements for many of these different techniques vary widely. Some can be just done by whoever wants to do them. Some require certification. We give a full list of the input requirements, but I'm trying to cut this presentation down to the bare essentials. So there are a number of techniques, Maitland, for example, which can only be done by actual physicians or certified physiotherapists. The Mulligan method, which is a more advanced version of Maitland, I am not familiar with the input requirements for that method. I have not found information on the internet. The Barbachenko method is also an accredited method, including manipulation, but they only admit physicians and certified physiotherapists. Dorn is a method used for reducing your level of pain, and they say 1 to 3 treatments or sessions already help. That's a type of training that anybody with some experience in massage can actually do that. And if you ever visit a Dorn therapist, you have to check. It's a good idea to check what certification that person has, because all these people need currently is a secondary school leaving certificate. So that's not really the same amount of knowledge about anatomy that a conductor or a somatopedagogue or a physiotherapist accumulates over years of study. Now, Bowen is a relatively new method in Hungary. There is no certification, no training, no input requirements for using this methodology in Hungary. And there is some practical expertise required in the training program. And basically they say on the website, well, if you have any experience in working in retail, then you can skip this part of the training, which is a red flag, basically. Now, there are other techniques where you need to be a physician. Let's just mention Szőke, which is a trigger point therapy, quite deep impact into both joints and muscle. FDM, fascia distortion model, is another therapy which actually applies pain as a therapeutic method. So they actually use a pain intensity of 7 to 8 on a scale of 1 to 10. So I don't think it's a good idea to take your kid and have them participate in a training that in a therapy that applies pain. Dealing as a method is an exception because it's more active than any of the other passive therapies. Where we find a difference is some of the training methodologies consider themselves unique, and some of them emphasize that a physiotherapist is not a manual therapist, a masseuse or masseur who provides medical massage is not the same as somebody doing manual therapy. So that's a distinction. There's a slide on actual manual therapy. I am not going to read out the Hungarian legislation that relates to it. But manual therapy includes a set of manipulations and techniques and procedures that are different than mobilization, because mobilization is a slow, gradual movement, whereas manipulation is when you make the body crack. Literally, that's what the lay people say when you stretch somebody to the end of their tolerance, and then you yank them and you actually crack the body and make joints pop. That is once again limited to practitioners who are physicians by degree. At the same time, there are techniques which people without the certification can also do without equipment. Just massage, smoothing out the soft tissues, applying pressure to parts of the body or to the whole body, and ending up with stretching and so on. What we need to talk about in the context of CMT is you should not overstretch people, joints, ligaments, because overstretching in the context of CMT can easily create micro lesions in the muscle, which then will result in callousing, basically regenerative issues with the muscle, which then in the future will further limit muscle function. So you want to avoid scarring, and because of that, you don't want to overstretch the muscle until it ruptures to avoid scarring. It's also important to always consider the basic existing range of motion of the patient and only extend it very gradually, step by step. Now, SZRT is a system developed by Dr. Valdemar Pfaffenrot. This is the Hungarian abbreviation of the technique. He works outside Munich, Germany, and he was working on research among CP patients, children, where he combined his own experience with the outcome of previous research efforts. And this is a synergetic reflex therapy developed primarily for cerebral motion difficulties, based fundamentally on manual treatments. But he did not consider this methodology as an exclusive one. It was basically a methodology to prevent the patient for active therapies. It prepares the patient for a bodily condition that will then facilitate more specific therapies going forward. The techniques he uses are soft tissue techniques, myofascial techniques, when you apply translation type motions to perpendicular to muscle orientation. We also use acupressure, which is not acupuncture. You're not applying needles, where you're pushing, exerting pressure on the specific muscle to loosen it up or to tone it. We apply stretching, we apply treatments to the reflex zones, mobilization, centralization, and we have additional techniques such as breathing. If you have the training and certification, that you can use craniosacral techniques. We also use some appliances in order to maintain the results we have already achieved. So when you have patients who already cooperate, then we can ask them to breathe out while we are applying the pressure to a part of their body, so they can cooperate. And of course, if you have the technique and if you have the certification, then you can actually apply acupuncture as well. But once again, that requires certification. Now, this is the myofascia that you can see on this video footage. This is the fibrous gelatinous sheath around the muscle, and what the basic technique is, this sheath can shift along the muscle while it is also adhered to the muscle, and when we apply pressure, we basically move these soft tissues. And we have reciprocal innervation, for example. This is something that is quite technical. But myofascial reflex, if you stretch a muscle too much, then it will contract and resist to stretching. If you use reciprocal innervation, then actually when you try to stretch your arm out like this, the antagonistic muscles need to relax in order for you to achieve stretching. And you need to find the optimum cooperation of these two antagonistic procedures, tightening a muscle and loosening another muscle or group of muscles. So we use very different techniques depending on whether you're working with tight muscles or lax muscles. When you work with toned and tight muscles, then you need to relax them. And we're trying to work in blocks, 3 to 4 times a year, but some of our clients return on a weekly basis for treatment. What is also important is that when you talk about muscles and joints, when they talk about muscles and joints, we really pay a lot of attention to their feedback. Now, sometimes sensory sensitivity is widely varying across individuals. Some might give you more feedback, some might give you less feedbacks. When you see this slide, conductive technology trademarked by the name Pető, which is well known in Hungary, basically can boast of being able to avoid hip surgery among children by using the right techniques. And Bobath and Boita are another two techniques used in Germany with a long history behind them. So what is it that you need to consider as a professional when you choose manual therapy, the type of manual therapy? You need to be aware of the basic diagnosis. In the case of CMT and another set of similar diseases, conditions, these are progressive diseases that gradually lead to the loss of functionality and skills, which means you should avoid overstretching and you should choose manual therapy techniques that do not overstretch. Also, you need to consider the ratio, the proportionality of pain and benefit, literally. When you sit for a long time and your neck is all tight and painful, and then you visit your massage therapist, you're not going to enjoy that piece of massage. So just imagine that multiplied in the case of a CMT patient. So whoever only passed the test for a short course of massage will have a very different and much more limited understanding of what's going on than somebody who has a fundamental training behind the massage skills. Let's say they are a physician or an actual massage therapist. Also, tight muscles and loose muscles are two different things. Often there are two different sets of experts who work with the two conditions separately, but it's always a good idea if somebody understands both skills and both techniques, because they are present in the same people, right? What is also very important is that no therapy is ever exclusive. We need to come back to the team idea. It is important that the various practitioners of these techniques should be part of a team. There are techniques that we can teach the parents to use, and we have a couple of cute photos here with babies and kids, and we provide information to parents on facial stimulation, for example. But this was just a brief presentation to wake everybody up after lunch. And please check our contact information for further questions.